Hello, 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 hello. Welcome, welcome, welcome. Come in, come in, come in, everybody. Happy Saturday. First and foremost, can y'all hear me before we even move to, oh Lord, before we move to anything else? Okay, can y'all hear me? Hello, beautiful people. Hello, hello, hello. Welcome, 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 welcome. Come in, come in, come in, y'all. Get on in here, get on in here, get on in here. Kick off your shoes and relax your feet. You are now in the den. Hello, my beautiful people, my tranquil ones, my powerful ones, my fierce fireflies. Okay, what up, gangsters? Everybody is welcome in the den. It's Selfcare Saturday. Child, it's been a while. I wanted to do this last week, but of course, that didn't work out. I had to switch it. So we here today, nonetheless, and I got some things I want to talk about. Hey, Kendall, how you doing? Thank you for coming through. What's up, Daria? You always one of the first ones to come through. Always appreciate it. Oh, I gotta put my person of the week too. I didn't even. I'm slipping, y'all. I'm falling off. Hey, Sierra, thank you for coming through. What's up, Candy Love? Thank you for coming through, y'all. So, of course, today is Self-Care Saturday. And, with Self-Care Saturday, I just talk about different self-care tips sometimes, right? We get into self-care tips, self-care ideas, positive affirmations, mental health awareness, stopping the stigma on mental health, breaking the silence on mental health, surrounding mental health, and breaking the silence and, just trying to put facts out there, just a different array of topics. And so this one is kind of going to be like a 3-for-1, okay, or maybe a 4-for-1, because first of all, this is kind of special, y'all. I didn't even realize it, but this is my 50th self-care video, and then I'll have what you should be watching right after this, and this is the 50th one for what you should be watching as well. So I was like, dang, I got 50 of these, I didn't even know. Okay. I was putting in that work, and when I first started these, for those of y'all that have already been rocking with me since the beginning, I used to do them every 2 weeks, and it used to just be a pre-recording. So of course now I do the lives, but being as though I was doing them every 2 weeks, because I was looking like, well, dang, how was it that I was able to do like brief sickle cell awareness, breast cancer awareness, domestic violence awareness, but it was separate videos. And I'm like, oh, because you was doing them every 2 weeks, and now we only do it once a month, so it's a little different. So I figured I would combine them all. That was the reason why I was really trying to catch last Saturday, because that was the 30th, and I didn't want the month to end without talking about sickle cell. If you guys have been following me on social media, or even if you see the community tab, you always see me stuff, sharing stuff about sickle cell or whatever, right? But over these, it's gonna be 2 years in January. Time is moving on since I started YouTube. We have discussed all different type of topics, right? Whether it was just the common causes of negative thinking, positive changes, PTSD, depression, protecting your peace, okay, which is very important, dealing with grief, suicide prevention, cause of lack of self-care, seasonal depression, holiday depression, stopping negativity, killing negativity, summer blues, having self-compassion for yourself, chronic pain and illness, injuries, okay. We talked about cancer, lupus, of course, like I said, sickle cell, breast cancer awareness, domestic violence, and many other things. And we're going to continue to do that, okay, and shine a light on it. So, a lot of times when people hear self-care, they just, like I mentioned before, would normally be like, oh, that's a woman thing, and probably just think I'm talking about, just getting your hair and nails did or going for some massages, which that's cool too. We like all of that stuff, right? But it really goes much deeper than that, when it's just all about us doing things that are essentially for ourselves and making ourselves, feel better and be able to get through the day to day, because it be hard out here in these streets, okay? So that's what it's all about. So yeah, you guys, like I said, my first topic is, sickle cell. Okay, bringing awareness to that. And of course, with sickle cell month, we normally go red. They already know my room is red, so and then I got my red on. But that is kind of personal to me because I do have the sickle cell trait and my sister has sickle cell, disease, right? So a lot of people don't even know that they have the trait, and it is a disease that impacts us. We're the highest rate, black and brown people, basically, right? So we definitely need to know about these things. Um, and it is something that is inherited that causes the red blood cells to sickle shape, right? Like a S shape instead of how they normally are. And it makes it hard for them to carry and deliver oxygen through the body. So, normally, when the blood cells get clogged in one area, that is the spot that they would probably get pain in. And that is what we call the sickle cell crisis. That's when they're in crisis, right? And it affects over 100,000 Americans, right? The majority, of course, like I said, who are black, right? And 1 in 3, actually have it. So that's a pretty big number, right? And it's a blockage of the blood flow, of course, right? That leads to complications such as chronic pain, anemia, infections, strokes, and different things of that nature, okay? And so, of course, like most of the current treatments, they know a lot more now than they did back in the days. Things have definitely changed and improved in some ways, but still need to improve in much more. Would be like blood transfusions, IV therapy, medications to prevent infection and, help with the pain. 1 in 3 people carry the sickle cell trait and don't even know they have it. So that's why it's so important for us to, like I said, make sure that we checked out, make sure that we know what's going on and things of that nature, right? Because if you are a person with a trait and you get with somebody else that's a trait, then, there's a chance that your child may come out with the disease. Okay. So let me see who else is in the building and say hello to some of y'all. And of course, y'all know, I'm sorry, I just kind of skipped into it. First and foremost, mental health check-in. How are we feeling today? How are we doing today? What's the vibe? Okay, how y'all making it through this week? Me, myself, this was a tough week. I feel like I say that every time we come up here. I've been really getting hit. Okay, I've been having a bob and weave on it. But I can say today, I am, for the week that I have had, I'm doing okay today, right? And I usually feel better when I get up here and I'm talking to y'all guys. So, shout out to y'all the real MVPs that be helping me along the way. But it has been a rough week, but I'm still blessed in spite of, because of, I'm still here. And so I'm still thankful for that. And so, um, how y'all doing? All right. And let me ask y'all that before I keep, jumping to other things. And of course, we want to remember to breathe, right? First and foremost, always. Sometimes we got to go ahead and take that deep breath in. Okay, hold it and go ahead and let it all out, y'all. Okay, and do that as many times as you need to. Hey, Miss Kara Speaks. Thank y'all for coming. Thank you for coming through. If y'all didn't get to see it, me and Miss Kara Speaks actually did. I joined her for her sip Saturdays that she be doing her Saturday sip, and we had a nice conversation. If y'all didn't get to check that out, go check it out. Also, subscribe to her if you are not already subscribed. Okay, get into it. I know that she has been I'm doing like Love is Blind. I don't watch it, but it might be some of y'all that do. And she's covered some of the BET movies, and she has her Saturday sip. She has her pajama Sunday. So definitely support her. Subscribe to her channel if you have not already subscribed. Hey Derry, I definitely appreciate you coming through. Appreciate it. Appreciate it. Um Definitely get into that. Lady Virtue, how are you? So yeah, you guys, like I said, it's been rough, but still making it through, right? We got to be here another day. Some did not, right? And so Go us, we still here, and we gotta definitely celebrate that. Thank you, Kendall. I appreciate it. Hey, Alicia, my beautiful sister. Hey. So, yeah, you guys. Candy says, my little cousin is back in the hospital suffering with another crisis from sickle cell. She was there last weekend, this week. Oh, yeah, I do remember you mentioning that in Miss Kira Speaks Live when we was up there. And I definitely have my prayers up for your little cousin. This is something that affects a lot of us, y'all. Um, my ex-husband and his mother didn't tell me he had the trait until I was pregnant. Could have been bad. Yeah, we must know and tell our partners. Absolutely, yeah. Definitely important conversations. And a lot of times we would probably think to ask about as far as physical illnesses go. But then when it comes to mental illness, we don't really look into that either, right? And that can have an effect too. So definitely all these conversations is important. It's good to know as much information as you could possibly know. It's good to ask doctors as many questions as you could ask them. Some doctors won't necessarily look for certain things, or even if they run certain tests, you may not know every specific test for them that they should be running, or you may not know the questions to ask them. Another good thing is to always get your medical records, y'all. And I really didn't know how important that was until I had started getting sick and having my injuries and going back and forth to the doctors. And I'll never forget one time when I needed my medical records and I got it. I had been complaining. I used to get like injections in my back for my pain. And I get my medical records, and I was telling the doctor, like, um, the first injection had helped, but the other ones weren't helping as much. And I had actually started getting boils on my back after the injections and different things of that. And lo and behold, when I actually went and picked up the records, this man didn't put not one complaint that I had in there. The whole time that I had been telling him all this stuff, he was busy putting, oh, patient says she feels just fine. She feels 100% better. The shots is helping her. So he was actually putting the complete opposite of what I was telling him. So it's always good to get your medical records as well. Okay, and check into what they putting in there. You can't all the time assume that every doctor's actually putting what you say. They sometimes want to meet their quota, and regardless of what you're saying, unfortunately, it's not in every case, but it can be some. They will be putting a whole nother thing there, y'all. So be careful of that as well. Um, Sierra says, yes, love when you are talking this talk. Thanks for a continuous conversation and education. Thank you. I definitely appreciate it. Lady Virtue said, it's been a rough week. My Aunt Mary is in the hospital with pneumonia. Oh man, liver and lung issues. I'm so sorry. I will definitely keep your Aunt Mary lifted up in prayer. I understand it being a rough Child, it's been a rough week, a rough month, a rough year. I feel like every time I turn around, so many people are sick. I sometimes be afraid to answer the phone because I get so many calls about, death. I've lost a lot of people, unfortunately, but you know, um, I will definitely keep you lifted up in prayer. Okay, other than lack of sleep has been pretty good. Kendall, I know about lack of sleep. I went from not sleeping at all, so I was sleeping all week this week, and it was kind of like a depression week, a depression sleep because I lost a friend last Saturday too. So yeah, it goes up and down. But you said you had a pretty good week. That's good. Yeah, that's all we could do is take it one day at a time, y'all. Some days is gonna be, easier than others. But we continue to push through as best that we can. That's all we really could do, y'all. Okay. So, you have like about 2,000 babies that are born with sickle cell in the US, right? Annually. And sickle cell, like I said, can lead to chronic pain, anemia, frequent infections, swelling, fatigue. Some people may have vision problems. Of course, this is not the same in everybody. Some people may have lung damage, kidney disease, possibilities of stroke, short in life expectancy, damage to hip joints and different things of that nature. It depends on like I said, the person is not everybody, right? But these are the things that we have to look out for. And of course, if you are dealing with, chronic pain, and you're dealing with frequent infections and swelling and different things of that nature, then that definitely can have an effect on your mental status. So that's why I'm telling you guys all the time that the physical and the mental kind of go hand in hand. And sometimes we'll pay a lot of attention when it comes to the physical aspect of it, but we don't pay as much attention when it comes to the mental, right? There's the mental that the person that's going through the situation feels. And then there's also the mental of the person that is the caregiver that may be helping somebody that's sick, right? Or you can have somebody who is taking care of somebody that's sick, but then they're also sick. And then the stress from, being sick and taking care of somebody that's sick, or you being the person that's sick, you just being able to keep yourself, from not having a daggone breakdown can really, really be a lot, right? And it makes sense if you really think about it. Like, it's not easy, especially if you have never been a person that's been sick before and it comes out of nowhere, or, and you've pretty much been accustomed to being able to do certain things a certain way. Or if you have been taking care of somebody that's sick for a long time, right? That is just gonna have a toll on you too. It's just, we are humans, so we're gonna like feel things at the end of the day and feel stressed, and sometimes need a break and a breather and need to be able to relax. It can definitely be very overwhelming. And so yeah, it's definitely a lot, you guys. Candy Love says, dang, Tamika, I'm glad you looked at your records. That really sucks. Some doctors can be lazy and trifling. Absolutely. We have to search for these doctors as well. I definitely have had my share of bad ones, and I've had my share of really good ones. And I had to go through quite a few before I got to a point where I felt comfortable with them. And now most of the ones that I have had, I have now had them for like 10 years, and I'm like, I'm good with them. I was so upset, and I mentioned this to y'all before, when my psychiatrist retired, because he was so good. He fought so hard for me, and I was like, am I gonna ever, find somebody like him again? And then they really did me dirty, because it just so happens that he left at the same exact time that my daggone counselor left. And I was like, are y'all kidding me? Both of y'all gonna leave at the same time, and y'all gonna leave right before the holidays, which is really the time that I normally need y'all to, what I'm saying, the most. But he was up there in age, and he had already been in his field for over 30 years. He wanted to retire. I get it, but like I said, good ones like that is hard to find. So even though on the one hand I understood, on the other hand, it was like, damn it, am I going to really be able to find somebody that is as good as you are, and that's going to have the care that you have? Is just, part of what we deal with. So yeah, you guys, I'm kind of all mixed up. We kind of jumping around today, but of course I told y'all about remembering to breathe, okay? And y'all know that we are here for the self-care of it all. To put ourselves first, remember ourselves. Okay, we can't take care of nobody else if we are not taking care of ourselves. And this is the place. You are in the right place. Okay. And this is my happy place. And somebody's calling my house phone. I don't know who that is, because I don't even answer that. Oh gosh, I'll be forgetting I have it sometimes. I don't even use that thing. That's hilarious. Um, Good vibes only, y'all. Okay, we are in the good vibes of it all. And self-care is not a luxury, it's a necessity. Okay, we absolutely positively have to put ourselves first. Ain't no ifs, ands, or buts about it. Okay, y'all. And y'all know that we were already officially closed for self-care, but like I said, I'm kind of all over the place. So I forgot about that, y'all, but we here. We are here. Um We are definitely here, y'all. So, you know, with sickle cell, what always was amazing to me was the fact that, you know, it would be like, let's just say, for instance, with my situation, with me growing up with my sister and how her having sickle cell, I could just remember times that she would be crying out in pain, times that we would have to take her to the hospital. Like I said, a baby can't talk, they can't tell you, you know, what's wrong. But of course, if you just see a baby is screaming nonstop in the top of their daggone lungs, and you know you did everything else and something ain't right, you know, you taking them there, right? And you know, her having to get treatments. And one concern that we always had, and we used to always have to ask the doctors, because of course with chronic pain you would have to get certain medications in order to be able to stop the pain. And it was always a concern for us with, you know, can she get addicted to these medicines that you are giving her? Are they too strong, and questions like that. And they would basically be like, oh no, it's fine, it's fine, you know, nothing will come of that, right? But in some cases it does, not every case. And that is a big concern as well. And on the one hand, we can have medications that can help us, but at the same time, y'all know how it go. Y'all see those commercials where it's all these different side effects, and if you're taking this, it could be helping you with one thing, but it also can actually, you know, cause other things. So we always want to be doing our research when it comes to things like that. And we also have a stigma around sickle cell patients. I told y'all I was in the nursing profession. I worked in the hospital for a long time. And I would get so pissed off because I would hear the nurses and doctors calling sickle cell patients sicklers. And a lot of time they would not really, to me, take their, you know, illness and stuff serious enough for me, right? It was like they just felt like the people was coming in here just to get medication. Like maybe they're not as in as much pain as they saying they are, or maybe they're not in pain at all and they're just coming in for the medication. And my thing is, how do you know that, right? We can't see somebody's pain. We don't know whether they're in pain or not, right? Two things you can never know with a person: what their pain is physically or mentally, right? I cannot stand to hear people say, oh, you do not look depressed. Depression doesn't have a look, right? And pain doesn't have a look. What it may look like to you, it may not look like to somebody else. So I used to really get pissed off when I would hear them say that. But unfortunately, that is part of the stigma that then surrounds them, right? And so sickle cell patients are not drug seekers. They have real pain that happens to require opioids, among others, to be able to manage it. So what do you do in the case like that? You understand what I'm saying? So that's the downside as well, right? Unfortunately, big problem around that. Um, Let me see. Jerry says it's especially hard seeing babies, yes, and young kids hurt. It really is. It really is. Hey Torian, thanks for coming through. Good afternoon to you. Yeah, so you know, that's definitely one part of it as well. That, yeah, Alicia, drug seekers, yep, that's what they call it. Kendall, yeah, that's awful. Candy Love. That's disgusting. Yeah, it is. It is. And so sometimes they would literally just leave them sitting, waiting for however long. You'll hear nurses, you know, making jokes about it and talking about it. And I just feel like it's one of those things where you're not in it, it's not happening to you, or maybe you don't know anybody that is happening to, and they just, in some cases, don't have compassion or empathy. This is what they've kind of been taught. And after a while, this is just what, you know, how they end up being looked at. And I don't think that that is right. And believe it or not, sometimes cancer patients go through this too. And we gonna tie it all in, y'all, because it really does all go together, right? As far as that's part of the reason why we have domestic violence and breast cancer awareness together as well. So yeah, that's something. Okay, that is definitely something, y'all. And so we definitely need to shine a light on that, and just make sure that more people are aware of it. Because everybody may not be. We can't always assume that everybody knows the same thing. Sometimes a lot of people do know, or they may know some of the things and have misconceptions and misinformation about some of the other things. And, sometimes people don't know at all. But that's definitely something that factors into it as well. All right, you guys. Intermission real quick. We about to move on um to breast cancer awareness and domestic violence. If y'all can, please hit the like button for me if you haven't already. And we will continue swiftly and professionally, okay? Okay, guys, before we move back into, or I should say, before we move on, because the next thing we're going to talk about is breast cancer and um, domestic violence awareness, right? Um, the way that you can help, whether it's with the sickle cell awareness, breast cancer awareness, domestic violence awareness, PTSD awareness, the mental health awareness, any of them, all right, is to show your support, shop for a cause, walk for a cause. I'm sure y'all have seen many, 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 many different types of walks that people do, right? You can donate your time to different organizations and charities. You can donate your money if you have it, but sometimes we don't always have it, right? You can donate food and clothes, water, and you can learn, right? Share facts, right? That's the most important things that we can do to help with all of these different causes. And that's why I try to get up here and share with little things that I can share for my part. Some things I know from me being sick, some things I know from family members that I've had that's been sick, some things I know from being in the health field and seeing things from there. So I try to give all my different aspects from all those different things that I can. And we all in this together. So of course, when it comes to breast cancer, we know that's pink. All right, we go pink for breast cancer. We go purple for domestic violence, right? And just like with a lot of these other days, I think I spoke about this when it was mental health awareness, right? When Congress put it into law to give them that day, and in this case with breast cancer awareness and um domestic violence. They did it in 1989, so it has not been around for that long, right? And we know that sometimes we have the month, but then we'll also have individual days, right? So when I spoke about mental health, we talked about it being a mental health week, a mental health month, mental health day, right? So as far as breast cancer awareness, we actually have Wear Pink Day, which is October 27th, but then we have Breast Cancer Awareness Month, which is, of course, the whole month from October 1st to the 31st, right? 1 in 8 women suffer with breast cancer, but this is not just a woman's issue. This is everybody's issue. Same thing when it comes to sickle cell. That's everybody. Men and women get sickle cell. So it's not about it being, you know, a man or a woman thing. We all get it. 1 in 8 women get it. 1 in 833 men in the U.S. have been diagnosed with breast cancer in their lifetime. There are over 3.5 million breast cancer survivors in the United States. And I have had a lot of my cousins and my aunts, especially on my dad's side, that have had breast cancer and ovarian cancer. Okay. So, one of the things we can do is get checkups, okay, on a regular basis. Those mammograms that irk my daggone nerves, child. Okay, I'm not gonna lie to y'all, I hate it. And for some reason, in these last couple years, they have had me come back to do mammograms like anywhere from 3 to 5 times. Every time you turn around, they be talking about, oh, we saw a shadow, we saw this, we saw that, and they be irking your daggone nerves. But we do have to take care of ourselves and watch out for these things, right? And then you have to look out for signs, of course, of irritation, pain in the nipple, any type of discharge that is not as a result of breast milk, thickening skin, scarred skin, red skin, things of that nature, right? We just always have to be on top of these. And when it comes to domestic violence, of course, like I said, that is the purple ribbon, okay? And we also have a Go Purple Day, and the Go Purple Day is October 19th, right? And so, again, this is a situation where it's not a man and a woman thing, you guys. There's 1 in 3 women and 1 in 4 men that have suffered from some sort of domestic abuse, whether it's physical, sexual, verbal, psychological, financial. Abuse comes in many different ways. I think when we talk about abuse, genuinely, people would assume, the physical, of course, first and foremost, but it really covers a broad spectrum of things, right? And it's also looked at one way when it comes to a female and another way when it comes to a male. And then we know that there's stigmas that surround around that too, right? If somebody says that they was abused, it's, well, what was she wearing? What was she saying, right? Where was she going? And that whole stigma around that. And if it's a man, a lot of times they would say, well, how's he being abused? He's a man, so there's no way he should be getting abused. And when it's a sexual abuse type of situation, I have heard many say, oh, well, he should have been happy and he should have liked that and things of that. What is he complaining about? And so when you want to say, like, why do they not come forward? You basically just answered your question, yourself. If you are over here talking about, oh, well, why did it take them so long? What was they wearing? What was they saying? Or how was they dressed? Or in a guy's situation, you saying he should have been thankful or happy about it. What is he complaining about it for? Then, of course, is that level of embarrassment, and is that level of blame, and is that level of, people aren't going to believe me. They're not going to listen to me. They're going to make fun of me for one reason or another. And that is part of the reason why people do not come forward about it, okay? And The CDC basically said what public health organizations, including CDC, state that 5.8 million women have been victims as a result of DV. Okay. And both cancer and DV are actually similar in complex social issues, such as discrimination, you guys, right? And isolation from supportive networks. So the same way I was saying there's certain stigmas around the sickle cell, it applies in this situation too, right? And if you have a woman that is in a violent relationship, most times they are at a higher risk to have delayed screening. So they would not find out some of the illnesses and things that they have, because if they're in a situation where, whatever person is abusing them, 9 times out of 10 they are in charge of them and where they go, what they can do. They're probably not going to the doctor and getting regular checkups and things of that nature, right? So they're actually at a much higher risk of not having things being able to be found out about them. And at that point, when they do find out, it can be an advanced stage. They can have a reduced chance of survival. So it's like, not only are you dealing with the fact that you're sick, but you are now dealing with the fact well, I should say it the opposite way. Not only are you dealing with the fact that you're being abused, but then you're not able to get the care that you need to be able to take care of yourself in the medical way that you need to, and you have that issue on top of it as well. So that is basically how it all kind of ties in as far as stigmas and not getting the help you need, not getting the support you need. Sometimes people are made fun of, and why would you want to come in for treatment or care somewhere that you feel like people are going to be making fun of you? Nobody is going to want to do that. And so that is another reason why a lot of times is not talked about and is not put out there, the way that we may want it to be. So think about it. They counting 5.3 million people. Think about all the other people that's not coming forward. That's the ones that they were able to count, right? Just hold that for a minute and think about that. And so that's the issue that we have. And like I said, it does not go by your sex. It does not go by your race. Of course, we know that there's kids that can be abused, teenagers that can be abused, adults that can be abused. We even hear about elderly abuse all the time. So it's no age boundary, it's no sex boundary, none of that. Like, this literally affects all of us, right? And women in abusive relationships genuinely have limited access to health care, right? They don't have healthy interventions. They don't have, just that access that a lot of us take advantage of that we have every day, right? And so, of course, this can further complicate early detection and treatments that could be life-saving for them, right? So it's like you're literally dealing with 2 different situations or 3 different situations all at one time. So yeah, you guys, that's a lot. Okay. Let me see what y'all talking about. Oh, thank you, Alicia. I appreciate you. I'm kind of all over the place. I didn't go in the order I was supposed to, y'all, but y'all know how we do. Okay, we're gonna still make it through, lean with it, rock with it, roll with it. Okay. Thank you. I appreciate it. Okay, yeah, I had to do a little switcheroo. Child, I was about to do 3 different ones, but then I said, no, I have a habit of overdoing it. I said, we're going to keep it simple and to the point. Yeah, but y'all got it. Y'all got it. Y'all here with me. So, yes, this is, all one-in-one things, guys. It really does go hand in hand. And it affects a lot of people, even if you're not the person that's going through it. I'm pretty sure that somebody knows somebody that knows somebody, right? So, Sierra says you're talking a lot of truth and coming with that. Thank you so much. I definitely try my best to. What's that, Moochie? What's going down, girl? Yes, that is a lot to deal with, a whole lot. It definitely is. And remember that stress can cause you to get physically sick, right? And physical sickness can definitely cause you to get stressed. You will 9 times out of 10 probably be a person that will end up having a lot of migraines. You might end up with blood pressure problems, stroke problems, all these other problems that you didn't have before. And a lot of people that suffer with depression usually have bad back problems. So this is all things that's added into it, right? So, child, it's a mess. Okay. So, that's definitely, the most important things that I just wanted to bring to you guys' attention. So you will see me sharing different things about breast cancer awareness, of course, throughout this month. And it doesn't have to be only in the month that we bring these things to attention, right? Whether it's with the breast cancer awareness, domestic violence awareness, sickle cell awareness, these are things we can talk about and bring attention to and awareness to 365 days out the year. Okay. But definitely when it is these times, I definitely try my best to shine a light on it and give as much input and, get as much input out there as I can to everybody. Okay. Because it is important to me. So, you guys, we are going to, of course, y'all know that I always like to kind of end it off with some positivity, some positive affirmations that we can use both as caregivers, that we can use as people that struggle with any type of chronic pain, any type of illnesses, those of us that may be going through all different types of abuse. You don't know what people are going through. You just never know. Sometimes you think you have it so bad and then you hear somebody else's story and maybe it's the same as your story. Maybe it's different than your story. Maybe it's better than your story. Maybe it's worse than your story. But you always kind of go like, dang, I didn't know they was going through all of that, right? And it definitely gives you a different perspective. So I think we just, sometimes have to give ourselves grace and give other people grace as well, right? We got to kind of remind ourselves to do that too, because baby, okay, sometimes it'll be a hot mess, y'all. All right. But we are going to start to get into our positive affirmations. Okay. So some of our positive affirmations that we could say, especially if we are somebody that's suffering, like I said, with chronic pain. My body is healthy, my mind is brilliant, my soul is at peace. Okay. My life has no limitations. I create the life I want. I accept that everything unexpected, I accept that every unexpected obstacle in my life is an opportunity to grow into a better person. I choose to learn and move on. Let me repeat that one. I accept that every unexpected obstacle is an opportunity to grow into a better person. I choose to learn and move on. Because we're going to have our obstacles. We're going to go through some stuff. You better believe that. That's just what life is, okay? Ain't no way around it. But we have to learn from it and be able to grow and be a better person and move on from it, right? And then every day I attract love, abundance, success in my life, and I inspire others to do the same. I hope I do, okay? And then the best years of my life are still to come. The best years in my life is still to come. The best years in my life is still to come. I feel like I had to read that one extra for myself, okay? I'm excited for the day ahead of me because something wonderful is going to happen today. I'm excited for the day ahead of me because something wonderful is going to happen today. I let go of the past. I don't worry about failure. I live in the present moment and I am happy. I let go of the past. I don't worry about failure. I live in the present moment and I am happy, right? I am getting healthier and stronger each day. I am getting healthier and stronger each day, right? Today is going to be the best day ever. Today is going to be the best day ever. All right. That's the type of energy that we need. Okay. And then the next one we have is your thoughts have power. Okay? Your thoughts have power. All you need is love for your subject matter, whatever it may be, right? When you do what you love, you can do it forever. When you do what you love, you can do it forever, right? I am capable. I am capable. I am capable, right? Rise up and live the life that was meant for you. Rise up and live the life that was meant for you. Rise up, okay, and live the life that was meant for you. I have permission to make time for that which I love. I have permission to make time for that for which I love. So these are more so for when you are pouring out into everybody else and sometimes you kind of forget yourself. You trying to multitask, you trying to do for yourself, do for the kids, do for your husband, do for a family member, do for a friend. That's beautiful. That's fine. We can do that too. But of course, remember with self-care, what we say, you cannot take care of anybody else if you don't take care of yourself. You have to put the oxygen on your face, right? Before you can even put it on somebody else. So these are things to kind of remind yourself and lift yourself up in the midst of you trying to do things for everybody else, right? And to tell yourself that it's okay for you to put into you. It's okay for you to get, out of this what you need to get out of this as well. Rise up and live the life that was meant for you, right? My dreams matter. I am capable and I have permission to make time for that in which I love. Okay? I'm on my own side. Okay? I'm on my own side. Like I pick me, I choose me, I'm a rise up. Okay? It's okay to say I sometimes. It's actually not selfish and people want you to feel like it is, but it's really not. It's what we should be doing because you gotta love on yourself sometime. If you don't love you, how can you expect other people to love you, honey? You gotta love you. Okay, so never mind being someone who is doing something, but rather be someone who did. Never mind being someone who was doing something, but rather be someone who did. Okay, y'all? Yes. mm-hmm. Definitely. Yeah, self-care is not selfish, y'all. For a long time, if you would say, oh, well, I'm worried about doing this and that for myself, you probably gonna have some people that's gonna be like, that's selfish and you only thinking about you. No, it's not that you're only thinking about you, but yes, you are thinking about yourself because if you are not okay and you have your own obstacles and different things that you're dealing with, that you're carrying, and then things just keep getting piled on, 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 and you never have a chance to step back and breathe. What you think gonna happen? Eventually something gonna crack. Okay, something gonna give. Either you gonna have to erupt and knock all that stuff off, or you gonna get buried underneath and you gonna be the one left there to suffer. It's one or the other. So which one you gonna choose? That's really what it boils down to. Sierra says, yes, I tell people you can't put into someone else until you fill up, and that's on period. Yes, absolutely. 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 So yeah, you guys, that is basically, what I have for today. I appreciate all of y'all that did come through. If today is not a good day, I hope that tomorrow is a better day, right? And as long as we have tomorrow and as long as we are still breathing and we do still have another chance, that means that we can keep on going, right? And if you don't feel like doing nothing today and you're not okay, that's okay too. Just don't give up and don't stay stuck there. That's the part that we got to work on, right? It's okay for us to lay down for a minute and be like, I ain't with it today. But hopefully the next day we like, all right, let me get up and try to do a little something, something. Okay. That's what my hope is for all of you. Of course, I hope that you enjoy the rest of your day. If y'all are still around and y'all are free at 4:30, I will be coming back for what you should be watching. We of course are gonna get into some of the things that are coming out for October on TV and streaming services. And we're gonna talk a little bit about my horror favorites. I know Kendall don't like horror, and there's probably a lot of other ones that don't like horror, but we're gonna talk a little bit about that too. And we're gonna have some honorable mentions as far as the things that I did get to watch from my September list that I thought was really, really good. So that is gonna be all the stuff that we gonna get into at 4:30. Hopefully I will see y'all there. If not, catch the replay. And if anybody was not able to catch this live and you are on the replay for this, let me know. Replay game, you came by, okay, put some flames up in the sky. Tell us some of the things that you do as far as self-care and positive affirmations and different things that you like. Sharing is caring. We like to hear from you. And yeah, you guys, that's it. I think I will be back at 4:30. Okay, and we will get into some things. Also trivia is coming back. I know I had to push all of these to the side, but trivia will be back next Saturday, and I'll be doing that once a month. Monday, I believe we have the Power Live. We also are going to be back to our throwback movie. I forget which one it is, but Moochie was out for a minute. Had some things going on. I had things going on my end too, so I had to switch a lot of the schedules around. But everything is going to start rotating again, like it was. And then y'all know every other Thursday we do our movie night with the ladies. And really, the only thing else is like my recap for Power is up, and the recap for Love at the Lockup, if y'all into that foolishness, is up. Y'all can check that out if y'all already haven't. But other than that, yeah, it's pretty much, the same things. So thank you all for joining me. I definitely appreciate it. Yeah, I know Uptown Saturday Night. That's what it is. Uptown Saturday Night. I was about to say Saturday Night Live, child. Shout out to Moochie. If y'all not subscribed to Moochie, which I'm pretty sure y'all all are, but just in case if somebody come through that is not down with Moochie Live reviews, okay, get into it, get them hammers up, and make sure that y'all subscribe to her too. Daria, thank you. So thank y'all. See y'all at 4:30.